So this talk is about NABH standards for emergency care. As you all know, NABH has prescribed standards for every aspect of medical care, and it is divided into 10 chapters. So the first chapter is on access, assessment, and continuity of care. So this is how it is modeled. The chapter have standards, and the standards have objective elements. And with reference to emergency, so the healthcare organization, or the eye care organization, has to define the healthcare services that it can provide. So that includes emergency services. And for emergency services, the organization need to have certain procedures applicable as per the laws and regulations, and also has to have documented registration process. I'll just take you one by one. The organization defines and displays the services that it can provide. For example, in eye care organization, if you are providing only eye emergency services, so you have to display that in your hospital or patient care areas. The important thing is that should be in consonance with the needs of the community. So we can define and display based on the language of the region. So it can be told in the brochure also. Ideal is to have a big display sign that you cater for ophthalmic emergency. But as per Indian National Medical Council, National Medical Commission law, every doctor has a liability to treat emergency patients. The second standard focus on well-defined registration and admission process, and that should be there not only for OPD or IPD patients, but also emergency patients. So there has to be documented policies and procedure for emergency patient also, and this should address all type of emergency. So this should address the check-in process or the registration process, the immediate assessment of emergency patients, the management part. The treatment includes resuscitation and then treatment, and also includes transfer out process and the outcomes. The third standard focus on mechanism of transfer. So many of our eye care organization may not have the infrastructure as well as the team to cater for treating the emergency patients. So we have to refer them or transfer them out of our organization. So we need to have certain standard operating procedures and policies for transfer out of these unstable patients. So who are these patients? So that has to be defined properly. These patients are patients whom we can't handle. They have non-ophthalmic emergencies. So we also should identify the staff who can accompany the patient during transfer and referral. And we also need to give a summary of what went through in our hospital, the patient conditions at transfer, and the treatment given here. Overall view of these standards includes the initial assessment and what all initial assessment we did in our hospital. And this has to be standardized, and it need not be same for all visits. Only for emergency care it has to be given, and it should also include nursing assessment, what our nursing staff did to the patients. The fourth one is about the time frame. So as you all know, emergency patients changes over initially from presentation to the other the crisis situation within a time frame. So you have to assess them as soon as possible, and also as per the need, we have to define the timing needed for emergency care. The history, progress notes, investigation, and the treatment order, everything has to be given to the patient. The last part of the AAC is patient care is continuous and multidisciplinary in nature. So even though we are ophthalmologists, we should also have certain qualified individual to as responsible for the patient care. We have to coordinate with the other treatment units in the other centers and the referral units. So the entire care process has to be coordinated within the organization as well as outside the organization. The last one, the information about the patient care and response to the emergency treatment has to be shared between the other team, the medical team, nursing team, other care providers. And this has to happen seamlessly between the shift as well as after the transfer. And transfer has to be done in a safe manner. So one of our staff has to accompany them to the till the patient is stabilized. And it's always better the entire process is streamlined properly, because that decides the satisfaction from the patient's point of view. Chapter 2 decides about the uniform care of patients in all settings, and it is guided by the applicable laws and regulations. And the care delivery has to be uniform when similar care is provided in more than one setting. Particularly, the emergency care has to be uniform. And it has to be based on the applicable laws and regulations. So most of our eye hospitals are registered under the Clinical Establishment Act. As per this act, we have to take or treat any emergency patient that comes to our unit or clinic. So we have to provide them emergency care, stabilize, and then transfer the patients. So this is a legal mandate as per the various NCI norms as well as the court verdicts. So the legal mandate, it is clear that it's our duty to attend to the injuries as well as emergency of the patients. And this has to be as per the requirement of the medical legal statutory requirement. And you all know medical legal case constitute emergency patients as well as trauma patients. So I just go through all this things since it's not needed for this particular instruction course. I'm moving otherwise. The next standard is about triage of patients. So before you initiate appropriate care, you also have to do a proper triage, see what type of emergency situation, whether we can handle it or not. If we can handle, initiate the emergency measure and then try to transfer. So you have to do a simple triage and advanced triage based on the existing triage guidelines and as per the NABH standards also. And then the transfer part. So we have to have MOU or some linkage with the ambulance services so that the ambulance has access and space inside the organization. It has to adhere to the Motor Vehicle Act because ambulance have different kind of licenses. Ambulances should be appropriately equipped and manned by trained personnel. And ambulance has to be checked on a daily basis for emergency drugs. If you have a MOU, see to that the organization check this on a daily basis. And if you are using the emergency medication, that has to be properly replenished immediately. Then CPR guidelines, Dr. Sunita has covered that. I will not go into the details. And whatever CPR activity you do, that has to be recorded and then has to be analyzed later on. And also we have to initiate corrective and preventive measures based on the post-event analysis. And even during the procedure, some patients can turn into emergency patients, both ophthalmic as well as non-ophthalmic. So you need to have qualified personnel to perform and assist the procedures. And there has to be documented process to take care of wrong site, wrong drug, wrong patient, etc. And care of patient in ICU, of course, many of our units may not have intensive care unit or high dependency unit. But if you are having a recovery unit for pediatric ophthalmic patients or other ophthalmic surgery patients, so you need to have adequate team to take care of this. And with reference to medication, there are certain emergency medicines that we will be using. And these emergency medicines, you have to check the expiry date as well as see to that the look-alike and sound-alike medications are taken care of. With reference to the PRE, patient rights and education during the emergency phase, you have to get consent from the family members and also communicate with them about the status of the patient. And also you have to communicate to them about the cost that can happen during the emergency process. And then infection control mechanism, particularly post-operative patients. And during this COVID season, you have to take care of the infection control mechanism, even in the emergency situations, and see to that all this process are all documented. So you need to have a structured quality system in place for emergency management. And of course, licenses are mandatory and risk assessment has to be part of your NABH process. And you also need to have proper facility to take care of the emergency patients and non-fire emergencies. And you need to have medical gas and oxygenation. And of course, train the staff on codes, various codes, and has to do a appraisal and also need to take care of the health needs of the staff. So basically, NABH standard focus on this structure, process, outcome. So if we have good structure and process, even during emergency, we can have good outcome. And it's important, very important that you have a proper team in place for enforcing these standards to get good outcomes. Thank you so much for your kind attention.